Ethical Dilemma Case 8, presented by Mariama Diallo, Marissa Felton, Tyra Furlong, and Tamarsha Roberts. Case 8, Patient Confession. A 35-year-old female comes to your office as a regular 6-month recall patient. She has been a patient in the practice since it opened 7 years ago and is always faithful in coming to her appointments. In general, she is in good health. The dentist completed one bridge a couple of years ago, and her probing depths are usually generalized 3 to 4 millimeters, with light supragingival and subgingival calculus localized to the lower anterior teeth. Some marginal gingival inflammation is present from poor brushing technique. This patient has been seen by the same dentist for years. The practice is building, and now with 4 hygienists employed, the patients are often scheduled with the first available hygienist. This patient has been seen by a different hygienist and then returns to the hygienist who normally sees her each recall. After the medical history review, the hygienist proceeds to do a full mouth probing and discovers that today's readings are significantly lower than the last visit and continues by complimenting the patient on her great improvements. The patient then reveals that the last hygienist told her that her pockets were so bad that if she did not brush and floss better, she would lose all her teeth. She was also told that her cleaning needed to be done every 4 months to help control the mess she was in. The patient said she was taking this information in, even though it was delivered in a demeaning manner by this other hygienist, while she was being tortured by the scaling procedure. She was in pain not only during the visit, but for 3 days afterward. The patient also said her 16-year-old daughter had a cleaning by the same person and was in tears from the pain when she came home. When the daughter's chart was pulled, it said, "Good oral hygiene and light plaque." This is not the first time you have heard this kind of information about this dental hygienist. There are ethical dilemmas within the study of ethics. Ethical dilemmas can occur in varying situations. In dentistry, ethical dilemmas occur when all options conflict with dental professionals' moral code. The moral codes within dentistry include patient autonomy, veracity, non-maleficence, beneficence, and justice. Case Study 8 is an example of an ethical dilemma occurring in the dental clinic. After reviewing the case study, it was found that quality care was not provided to the patient in the scenario. The ethical dilemma was rephrased into a question as follows. Is it ethical for a hygienist to talk harshly to a patient about their oral hygiene to boost the patient's home care practices and improve their oral health? And the ethical category that our group chose was overtreatment, and that's because of the 4-month recall, even though the patient has pocket depths of 3 to 4 millimeters, due to the patient being influenced on oral care at home and in office by the hygienist's harsh treatment, and overtreatment also includes rough scaling practices and overscaling, which the hygienist performed on the patient. After step 1 of identifying the ethical dilemma, we move on to step 2, which is collecting information. This includes collecting information that we do know, as well as figuring out what information we don't know. So the information that we do know is that the patient visits the dental clinic faithfully every 6 months. The patient typically has 3 to 4 millimeter pocket depths. After seeing the other hygienist, the patient's pocket depths are significantly reduced. The other hygienist put the patient on a 4-month recall. The patient and their daughter had painful experiences with the other hygienist during and after their appointment. The patient recounted a statement made by the other hygienist that was harsh and demeaning. The patient stated that they took in the information and feedback given and applied it at home. However, the missing information is, what is the other hygienist's point of view? Does the other hygienist adapt their instrument when scaling? Has the other hygienist received this feedback from patients or other patients? What is the other hygienist's rationale for conducting their oral hygiene care in this manner? With all of this information, we'll be able to move on to step 3, which is figuring out what options we have in moving forward within the ethical dilemma.
Step 3. State the options. Option 1. Inform the dentist and manager of the patient's concerns during her and her daughter's visits. Option 2. Pull the hygienist aside and discuss why they performed OHI the way they did. Option 3. Make a note in the patient's chart to only be scheduled with me. Option 4. Report the hygienist to the doctor or manager for malpractice. Step 4. Apply the ethical principles to the options. Option 1. The hygienist is not following patient autonomy. By using scare tactics with OHI, the patient is being coerced by a provider. The hygienist is not following veracity as they are not being honest. Option 2. The hygienist is not following veracity or justice. The hygienist is lying to the patient and is not giving fair and appropriate treatment to all patients seen. Option 3. The hygienist is not following non-malfeasance as they are bringing pain to the patient during and after the appointment. Option 4. The hygienist is not following patient autonomy, non-malfeasance, benefits, justice, or veracity as they are lying about the patient's status, coercing them through scare tactics, not providing appropriate treatment, and bringing the patient pain instead of taking it away.
Step 5, make the decision. We would report the hygienist to the doctor or the manager for malpractice. The hygienist is not following patient anatomy, non-maleficence, beneficence, justice, or veracity as they are lying about the patient's status, coercing them through scare tactics, not providing appropriate treatment, and bringing the patient pain instead of taking pain away. Step 6, implement the decision. When bringing information to the doctor or the office manager about another employee, gather as much information as possible along with patients' concerns and complaints who have experienced maltreatment from the hygienist. We want to cross-reference dates when patients were seen by the hygienist and notate the overall experience each patient had while in the hygienist's care. State to the doctor and the office manager specific details about the hygienist's unethical characteristics. For instance, how the hygienist notes don't correspond with what the patient stated while conversing about her last appointment. The hygienist notes state the patient's oral health condition is good, however, the patient advised the prior hygienist stated otherwise. By discussing the actions of the hygienist with the doctor and the office manager, they both will be able to intervene and come up with an action plan for the hygienist moving forward while providing care for patients.
The 6-step ethical decision-making process provides a structural approach to navigating moral dilemmas that may be faced within one's career or life in general. The process involves identifying a problem, gathering relevant information, evaluating the options, applying the principles to the alternative options, making the decision, and implementing the decided solution. Reflection of the outcome may be an important step following the process as well. By implementing these steps, as demonstrated in Case 8 above, it can be ensured that the decision made aligns with the ethical principles. The method shown demonstrates analysis and accountability, as well as ensures consistency and integrity in the decision-making process.